I think that it is, of course, all APL patients have a risk of early death. So there should be a vigilance for all patients. However, I think it's important to assess those or to identify those patients with especially high risk. So you could be more vigilant. You may take your blood test more frequently, up to 4 times a day. You have to act very aggressively when the platelet count or the forbidden counts are below the thresholds. You can also, I think that's something we discuss, whether the very high-risk patients should be in the ICU, where you have better chances of surveilling the patients and taking frequent blood tests and acting on them. So I think it's still important to be able to identify those with a very high risk of early death, and that you can do it very early. As soon as you have a suspicion of APL, you can score this patient and assess the risk of early death. So I think it's a useful way to assess the risk and have a tool for that as soon as you identify or have a suspicion of an APL patient. Yeah, I think the most important actions to prevent early death is first to have a very low threshold to suspect APL. It means that if you have any sign of APL in a new patient that comes into your care, you should suspect APL. And then you should know that APL is a medical emergency. So you need to institute ATRA treatment as soon as possible. You should have ATRA in your ward so you can give it directly to the patients. And then you have to assess all the blood chemistry, the platelets, the white blood cell counts, of course, and the coagulation parameters. And then you should, based on the thresholds, the guidelines that are existing now, for instance, the ELN guidelines, you need to be very aggressive with transfusions of platelets and fibrinogen. And then you also have to a bit assess the risk of early death, and then decide how often should you test these parameters. And also very important is that you act directly. When you have platelet count or a fibrinogen count below your threshold, you should act very quickly on that. So I think early ATRA and aggressive transfusion policies, as we know now, it's the most important preventive measures to prevent early death.